boys and girls, and everyone else who's joining us today. This is Mnemonics with a brand new video. Um, I wanted to kind of get this one out pretty quickly, and if you like the videos that I'm producing, click the like button. If you like the content that's in this video, please let me know. And if you also like the videos that I am producing and I need to know about that, well, just click the subscribe button so you know when those get dropped, and for me to know that I actually am producing something someone's actually interested in. And without further ado, let's get moving. All right, you guys can read. So this is just a medical disclaimer, meaning that this is strictly just for educational, it's just for fun. If you have a serious medical problem, go see a medical professional, and please don't sue my ass. I'm going to swear a ton in this video. I've been swearing in past videos, and I'm going to swear in my future videos, and for that, I'm definitely not sorry, so tough shit. Okay, so this video is actually going to be really quick. It's that time of year where people have to recertify their ACLS or their BCLS training, meaning like basic, life support for CPR, and anyone possibly has to do this, whether someone for work or if you're in the healthcare, medical field, what have you. This is a very basic introduction video. This is essentially just to help you get like essentially a good footing as to like what the hell is going on and what to do in what order. This is by no means, as I'm going to have a slide in the future, that this is by no means like an actual replacement for certification or training. I essentially just want to make this an introduction to kind of help you, to give you some advice how to kind of organize the steps of what to follow and what to do next. And I'm only going to use one basic example because there's like adults, there's kids, there's infants. Like I'm just doing the basic stroke, like basic approach here of just like one adult. And what I'm going to do is I'm going to put a link up in the right-hand corner for my other videos for EKG basics and EKG examples that actually go along very nicely with this topic, because there are some parts that are going to involve EKGs. And if you look at them and you don't know what the hell you're looking at, well, you're probably going to have to go watch the other videos if you actually want to figure out exactly what the hell I'm talking about. So without further ado, let's get going. Okay, yeah, so real quick, like I said, this is a video that does not replace or count as certification or training. This is simply just advice or a little bit of guidance to help you prepare for your certification. Or if you're just curious about what the hell this video is about, by all means, you're more than welcome to watch and get what you can out of it. But by no means is this a replacement for like any professional training. This is essentially just me fucking around, having fun, making a video, and just sharing a little bit of mnemonics to kind of help teach you and essentially give you some advice as to how to approach the steps to basic life support. All right, so let's get going. Okay, so real quick, I just want to put some names out there so you can have a little bit of idea what the hell these things mean. So the first one's going to be CPR, which is going to be cardiopulmonary resuscitation. Next one's going to be BLS, which is basic life support. ACLS, this one's a bit of a mouthful. It's advanced cardiovascular life support. An AED, you've probably seen these hanging on the wall, or you've heard this, acronym before. It's called the Automatic External Defibrillator. And then ROSC, which is called not called, but stands for Return of Spontaneous Circulation. And the list goes on. I could put many other, short acronyms on here, what these things mean, but these are essentially the basics that I just want to present to you. So when I go through this video, you're not completely lost. All right, so let's advance forward. Okay, so where to start? When you're doing your training and after you read the book and you get really fucking confused as to like where you're supposed to start, when you actually start the scenario, you sometimes can blank and you go like, shit, like what am I actually supposed to do? So to help you with this, I actually made a very simple mnemonic for this. So first off, the situation is going to be just you, meaning one person, meaning there's not two healthcare professionals walking around, because that can kind of make this a little bit more complicated. You did witness an adult male collapse and you're with bystanders. So you're not in the middle of the woods by yourself with your buddy, and it makes the situation more complicated and it makes the steps actually different. So depending on the scenario you're in, it can actually change. So if this was a kid, or if this was an infant, or if you were in the middle of nowhere, it would actually change the steps of what you're going to do first. So this one's like a very basic start where you see somebody and you're essentially by yourself as like the healthcare person that's going to be, applying BLS, but you also have bystanders. You can tell them to do things. So you have to go do it yourself. So I want to make this a little more simplistic than the more complicated scenarios that you can run into when doing this training. So the question is, what do you do first? And like I said before, I made a very simple mnemonic to kind of help jumpstart your brain to get a footing as to what you're supposed to do first. Okay, so what you want to do is called start CPR. So you're going to do what's called the 4 S's, okay? So first off, when you see someone collapse, you want to make sure the scene is safe. Meaning, like, is there like electrical wire swinging? Is there fire? Like, you don't want to endanger yourself just for the sake of trying to help somebody else. If you can't keep yourself safe, then you're gonna have 2 people down instead of just one. So the whole point is make sure the scene's safe and that you're not endangering yourself on top of this person being also in danger. And that what you're gonna do is you're gonna approach the person and you're gonna shout at them and you're gonna ask, "Are you okay?" And if they're not responding and they don't seem like they're moving, if they're conscious, then what you want to do is this is the whole point of the bystander is to send for them to go get an AED so you can stay with the actual person that's down. And then you want to start the emergency response. So have somebody call 911 to get an ambulance to come to your location as soon as possible. So this is what you want to do is the 4 S's. So is the scene safe? Shout at the person. If they don't say that they're responding, send for an AED and then call 911. These are the 4 S's. So next what you want to do is a C. So you want to check for a carotid pulse and you want to see if they're also breathing. You want to do this at the same time. This number can be subject to change, but they want you to at least do it for 5 seconds and no more than 10. And the reason for that is if they actually do need CPR, meaning chest compressions, you want to start that as soon as possible and not delay that. So they give you this time frame about 5 to 10 seconds, and that can change. But for now, I believe that is the standard of care to do 5 to 10 seconds. So essentially what you're going to do is check the carotid pulse, which is the pulse in the neck. And when you do it, don't reach around in front of the neck because it looks like you're choking them and other people that are filming this, it's not going to look good for you. So don't do that. So essentially what you're going to do is check for a pulse. And then if they don't have a pulse, then you immediately need to start doing CPR, like immediately. So you want to start pressing. That's what the P is for. So P is for pressing on the chest and doing chest compressions. And then after that person comes back with an AED, as you're doing chest compressions, you want them to put the pads on in the correct places and hook it up and turn on the machine so that you get that thing going because you want to see if the rhythm is shockable or not. And I'll talk a little bit more about that at the next mnemonic. But the whole point of this is to start CPR. So you want to start with 4 S's, which is check the scene, shout at the person. If they don't respond, send for an AED, and then you want to start the emergency response by calling 911. And then you want to do CPR. You want to check for the pulse, which is the carotid. If they do not have a pulse and they're not breathing, you want to start doing chest compressions, and that's for the P. And then for the R, it's going to be for rhythm, which is the AED, which is the automatic external defibrillator with the pads, is actually going to tell you what kind of rhythm you are dealing with. So this is what you want to do and kind of have the mind frame of what you want to do first when you approach somebody that you've witnessed a collapse that potentially needs basic life support. And then I just put a little, short snippet of everything I just said up in the right-hand corner. All right, here's some numbers. So here's another mnemonic. I feel like that can help. And again, this is for an adult. This is very basic, and this is for one person because there's 2 people. It changes. If it's a kid, if it's an infant, like these numbers are subject to change. So this is just for a basic adult, and it's just you, one person providing BLS. So just remember 1, 2, 3, ABC. So for the A is going to be for the 1, and that's going to be 100 chest compressions per minute. So I had a little joke in the beginning in the opening introduction frame saying that like this makes students sing the song "Staying Alive" because the conception or the concept here is that you want to go to the rhythm of the beat of that song, which is like a cheesy, I believe, like late '70s song. It's like a disco song. So if you want to, just look that up. And essentially, that is the beat and how fast you actually want to be doing chest compressions, and that actually equals ultimately to about 100 chest compressions per minute. And the next is going to be for the 2s with the B and then the 3s with the C. So it's going to be 2 breaths for every 30 compressions. And I have those bolded here in this line right here. And this is for an adult and it's one person. So it's going to be a ratio of 2 to 30, meaning that every 30 compressions, you're going to do 2 breaths. So just remember 1, 2, 3 is ABC. A is for 100 chest compressions per minute. 2 in the B is for 2 breaths for every 30 compressions. And it's a 2 to 30 ratio. So that's 1, 2, 3, ABC. Okay, so you witnessed a collapse. You did start CPR, where you did the 4 S's and then C, P, and R, and you're doing chest compressions. Someone's getting the AED, they're slapping it on. And now you have the AED on and you're following the instructions. Now what do you want to do? Well, that's what the next slide's for. Jeez, I can't talk. That's what the next slide is for. So what you're going to do when you have the AED on, and it actually can read the rhythm, whether if it's shockable or not, this is what you want to do next, which is called the ABCD method. So first off, like I said, you're doing compressions, the AED is on, it's attached, and it's turned on. What you want to do is you want to apply a shock. And this is a question mark, meaning when the AED is actually reading the rhythm, it can tell if it's a rhythm that is shockable or not shockable. And it'll tell you it's going to deliver a shock or not deliver a shock. So this is the first thing you want to do. So it'll prompt you that it's going to shock, and then you want to clear the body, and you have to say clear and all this other stuff just to make sure that nobody gets shocked in the process. And then you push a button, and it quote unquote defibrillates and delivers a shock. So that's the first thing you want to do. And then if you can, then you're going to do blast. And that's what the B is for. And this is where you're going to deliver the shock, and it's going to be defibrillate. And a little caveat here, if the AED says do not shock, you're going to skip B and you're going to go directly to C, which is your immediately, I mean, as fast as possible, continue chest compressions. And you're going to be doing this for 2 minutes. Like, besides like the AED delivering a shock, like the chest compressions is like really the number one thing that's like keeping this person alive. Like, this is like going to increase their rate of survival. The less interruption of chest compressions, the better the outcome is going to be for this person. So it is really imperative that when you're letting the AED doing its thing and you stop chest compressions, you really need to make sure that you get back on that as fast as possible. So the less interruptions, the better the odds the patient, or not the patient, but like the person down is actually going to have a better chance of survival. So I just really want to emphasize that. And then after the 2 minutes, there are going to be certain pauses in the algorithm because they're going to give you a card with BLS and ACLS, and you're going to have to follow this algorithm, and it's going to change, being like you go to the right, you go left. If it's a no, if it's yes, like it's going to send you all over the place. And that's actually where this gets really confusing. So at one point, it can ask you after you do chest compressions, is can you give them drugs? And I put an example here of like epinephrine, but it could be like amiodarone, it can be dopamine, it could be like atropine. It really depends like what the rhythm is, like if it's fast or slow, or depends on like what you're dealing with. So I just put this one example of here, can you actually give a drug? And then what you're going to do is you're going to want to repeat this, and you want to keep repeating this the whole point. So for the next every 2 minutes, you're going to go through A, B, C, and D. You're going to look at the AD, like you're going to pause chest compressions very quickly. The AD is going to read for the rhythm and see if you can actually shock it. If you can shock it, you're going to go to B and you're going to blast them. If not, you're going to skip B and go directly to C and get back to doing CPR and continue circulation and do that for another 2 minutes. And then after the 2 minutes, you want to see if you can give them drugs after the 2 minutes of administration of CPR. And you're going to repeat this until they have ROS, which is return of spontaneous circulation, meaning they kind of snap out of it and start breathing on their own, and their heart starts pumping on their own. Or an ambulance arrives where the actual paramedics or EMS can actually take over, and they can take it off your hands and then take them to the hospital for further treatment. So this is the ABCD method. Okay, so just a quick tip as to which rhythms the AED can shock and not shock. So shockable rhythms, V is for the volts, meaning that these are the ones that can get shocked. So it's going to be ventricular tachycardia, also known as pulseless VTach, or ventricular fibrillation, meaning VFib. These two you can shock. And the AED will be able to recognize these, and I'll have a picture of these on the next slide, and it'll say, yes, we are going to deliver a shock. These are shockable rhythms. Clear the patient, yell clear, make sure everyone's clear, and then push the button, and it'll deliver a shock. Ones you don't shock are called asystole, which is flatline, and then PEA, which is pulseless electrical activity. These you do not shock. I mean, if you watch medical shows, they'll see flatline all the time and they'll say shock. That is completely inaccurate. You do not fucking shock these. Do not shock asystole and do not shock PEA. It won't do anything, and if anything, it'll actually make it worse. Do not shock these. Okay, so real quick, so shockable rhythms or V's are for the volts. So I just have quick pictures of these. This is VTach on the top, and then this is VFib on the bottom. And if the AD can identify these, it will tell you to deliver a shock. And if you actually go to my EKGs examples video, you'll be able to see more in depth actually what these are, what they look like, and the treatment to actually try to resolve these issues with these dangerous arrhythmias. Okay, the next we're going to have non-shockable, these ones you don't shock. So the flatline, which is going to be the one here on the right, and then PEA. And I put like a normal looking sinus rhythm EKG in here. It can actually look like anything. It can look like AFib, it can look like this, it can look like atrial flutter, but essentially it can look normal or it can look slower as well. So there's not like a specific view of what PA looks like. It can look normal or it can look like something else that doesn't seem like a flat line. But just to reiterate, with asystole and PA, do not fucking shock these. I do not. They will. I really hope they don't pass you if you try to do this in a class. Like, just they will reiterate this wherever your instructors are when they're doing your training and the certification. Do not shock these. Again, one more time. Don't fucking shock these. Okay, so real quick, I put in 2 quick mnemonics of the causes of cardiac arrest. So like when you're doing CPR and you're doing chest compressions every 2 minutes, you have to start thinking of as what cause these things. And these are called the H's and the T's. So the first ones I'm going to start talking about are the H's. So the H's are here. So hypovolemia, meaning low volume, hypoxia, which means like shitty oxygen delivery getting into circulation, protons, which is you know, a symbol for acidosis. And then you have hyper and hypokalemia, meaning high or low potassium, and then hyper or hypothermia, meaning high or low temperatures. So I have a nice little mnemonic in how to actually remember these. So use the word vodka. So V is going to be for volume, the O is going to be for oxygen, D is for DKA, which is caused by having an acidosis. So you just have that kind of a simulation there between these two. K is for potassium, because that's the actual element symbol of potassium. And then think A for hot, which is temperature. So if you remember these are going to be the H's that can possibly be causing a cardiac arrest. All right, so now for on the T's. T's are going to be over here, so it's going to be toxins, trauma, tension pneumothorax, meaning they either a drop lung or puncture, and you're going to have trachea deviated to the opposite side. A thrombosis, which could be a clot in the coronary artery of the heart, causing an MI, which is aka a heart attack. You can also have another thrombus, which could be a pulmonary embolism, which is another clot in the lung. And then it can possibly be cardiac tamponade, meaning that there's a sac that's around the heart, and if it's compressing the heart and the heart cannot actually expand and contract in the way that it's meant to, it can actually essentially get strangled, and that's called cardiac tamponade. Okay. So for the way to remember this, I don't have a strict mnemonic, but it's more of like a story. It's kind of sad, but hey, it sticks. And every time I think about it, you can kind of work your way through it to remember exactly what it means. So if you broke up with your ex, if you got really drunk, and I'm not advocating drinking and driving, I'm just saying that just for this serious simplicity of trying to remember this, and it is a traumatic situation, I thought this would be a good way to, try to connect the memory of what the T's are. So if you broke up with your ex, you're going to be doing some drinking, so that's going to be the toxins. And if you're drunk driving, you're more likely going to crash, which is going to be the trauma. If the airbag deploys and it deflates, just think of a drop lung, which is the tension pneumothorax. And then the thrombosis, which is the heart attack, will be your heart's broken because your ex broke up with you. And then the pulmonary embolism, which is the clot in the heart, or clot in the lung, excuse me. You can't breathe because essentially you just been in an accident. And then cardiac tamponade, you have a seatbelt that goes on the chest. So something that's squeezing the heart and preventing it to fully contract and expand when it needs to, when it's doing actual pulsations and actual contractions. So I know this one's a little bit of a stretch, but I do think about these that there's 2 things for the lungs, 2 things for the heart, and then there's trauma and then there's toxins. So you just remember that. This should be fairly easy with the story of broke up with my ex and, terrible drunk driving. So that's the correlation of how to remember the terrible T's for cardiac arrest. Okay, so this is just like a quick recap, like flow chart to kind of make it a little bit more complete. So an adult collapses. You do start CPR, which is going to be seen. You're going to shout at the person. You're going to send for help, get an AED, and then you're going to start the emergency response, meaning you're going to call 911. Then you're going to check the carotid pulse for about at least 5 seconds, but no longer than 10. If you don't feel any, start doing chest compressions. And then as you're going to be doing this, you're going to do this for the next 2 minutes while you're waiting for someone to bring the AED back so you can hook it up and check the rhythm. So that's what the 4 S's and the CPR are for. And then while you're doing chest compressions, you want to do 100 chest compressions per minute. And then you want to give 2 breaths every 30 compressions if possible. And that's the 1, 2, 3 ABC mnemonic there. And then once the AED does get delivered and you hook up, put the pads on, turn it on, and it starts talking to you and it starts spitting out instructions, what you want to do is you want to do the ABCD, as in, is the AED telling you to apply a shock? And if it is a shockable rhythm, it's going to tell you to blast, therefore delivering a shock. And then after you deliver a shock, you're going to do 2 minutes of chest compressions, which is going to be the C. And after you're done with those 2 minutes, you want to know if you can give any drugs. And if not, then you're going to go up back to A, and you're going to start the whole chain again. So you're going to go A, B, C, D, A, B, C, D. I'm going to say it one more time. You're going to go A, B, C, and D. You're going to keep doing that. You're going to keep doing this every 2 minutes until you have ROSC, again, which is return of spontaneous circulation, or the ambulance arrives and takes over for the transition of care for this person. So that's how this works. It's start CPR, do 1, 2, 3, ABC, and then follow ABCD mnemonic, and just keep doing that and just keep cycling through that every 2 minutes. So with this recap, when you actually go to your training, they're going to give you a book and little cards, and these little cards are going to have like little flow charts just like this. But the problem is, if the answers go yes or no, they change. The instructions are going to change of what to do. You can go to the right, you can go to the left. Like it can go from a shockable rhythm to a non-shockable rhythm. It can go from a very fast heart rate, like a very fast arrhythmia, to very slow arrhythmia, and they're going to change this on you. It can go from right to left, up, down, forwards and backwards, and it's actually really quite frustrating. So the reason I wanted to start with something very basic, which is just one adult and just you and some bystanders for someone to go get the AED and come back, I wanted this to make like the most simplest scenario for you, so you can actually start with this and build on it and get better for the ones that are a little bit more complicated when you're just by yourself, or it's just a kid, or if you're in the middle of nowhere. Um, and the situations just get a little bit more complicated. So this is like the very basic one for an adult when you witness someone collapsing from cardiac arrest. Okay, so I do have a bonus slide. So if you do the start CPR and you do your 4 S's, and then you get to the C and you realize they do have a pulse, but they're not exactly breathing. So if they have a pulse, don't start doing CPR, because their heart is pumping and doing all the work that it needs to be doing. It's perfusing the organs, perfusing the body, that is actually doing that part of its function. And if they're for some reason not breathing like totally, like if they're gasping, like apparently that doesn't count as actual breathing. What you want to do is you want to provide ventilation for them. So what you're going to do is you're going to do, and this is for an adult, not for a kid, not for an infant, but for an adult, you're going to do 1 breath, and it's going to be delivered every 6 seconds. And the way to remember this is that a B looks like a 6. So you give 1 breath every 6 seconds. So you're going to do 10 breaths in 1 minute. So I thought that was a neat little, a little nugget of information that can sneak into this, whole tips of ACLS and BLS. All right, that's it. Those are all the tips I have. Again, this is just kind of help you get your footing and just like an idea of what you're going to be dealing with when you start BLS. Like if you've never taken it before, this actually would be pretty helpful to kind of just give you some simple tips and tricks of how to keep this straight in your mind of like what you're actually doing. Because looking at those cards and looking at those algorithms actually can get extremely confusing. And I remember it would throw me through a loop, being like, wait, do I shock, not shock? Do I switch to this? Do I do a drug? Do I do CPR? Like, what do I do next? Like, just having that, like, just, very simple, short mnemonics of just start CPR, 1, 2, 3, ABC, and then the ABCD method every 2 minutes, and just keep cycling that. That gave me a good foundation of like what I need to do, especially when you're under pressure and you're being, graded. And like, if this actually happened, like, you need to like, think when you're under stress and be like, okay, what do I do? I need to start CPR. I remember that one mnemonic from that one video I saw that actually was really helpful to kind of kick you in towards gathering the other information back from what you need to be able to execute and do what you need to help someone, you know, survive this, traumatic event. So that's all I'm trying to say and trying to help. So hopefully this was helpful. If you like this video, obviously click the like button. If you like the videos I am pumping out, please click the subscribe button. Also, definitely go check out my EKG basics and my EKG examples that further go in depth about the rhythms that I mentioned earlier in this video. And yeah, if you have any other tips or tricks when it comes to ACLS or BLS, by all means, drop in the comments below. Let me know if you like these mnemonics, or if I actually did a shitty job. Like, actually let me know. So yeah, I will try to come out with a few more videos in the next couple weeks. And yeah, so I hope everything's going well. I hope you found this video very helpful. All right, I'm going to shut the fuck up so you guys can study and go learn how to do CPR and all that fun stuff and try to help save someone's life. All right, love you guys. Good luck studying, and I'll see you in the next video. All right, peace.